From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
Welcome to this news roundup. I'm Kate Schweitzer, Associate Managing Editor of JAMA Medical News. On today's episode, we're talking about two related stories we published in recent weeks. The first is on the U.S. Department of Health and Human Services' plan to restructure its agencies and lay off 10,000 workers as part of the administration's Make America Healthy Again program. Then we'll discuss how recent workforce and program reductions at the U.S. Centers for Disease Control and Prevention will affect public health. Lead senior staff writer Rita Rubin is joining me today. Hi, Rita.
Hi, Kate.
So let's start with the HHS. Our team collaborated on reporting this story, and it was co-written by you, Rita, and Medical News Director Jennifer Abbasi. In late March, the Department of Health and Human Services issued a press release announcing a massive reorganization and major structural changes as part of the Trump administration's Make America Healthy Again initiative. These changes included eliminating approximately 10,000 employees from several major health agencies, including the U.S. Food and Drug Administration, the CDC, the National Institutes of Health, and the Centers for Medicare and Medicaid Services. They were all included. Now, these cuts come on top of a previous 10,000-person reduction through early retirement and resignation offers. So all told, the changes will reduce the federal health staff of 82,000 by nearly a quarter. The restructuring will also consolidate 28 HHS divisions into 15. It'll create a new administration for Healthy America composed of 5 existing agencies, and it'll narrow the CDC's focus to epidemics and outbreaks and bring the Administration for Strategic Preparedness and Response, or ASPR, under it. The HHS announcement stated that altogether, these changes will make the HHS more responsive and efficient, and that they would save taxpayers an estimated $1.5 billion annually. But in the aftermath of this news, many experts still have a lot of questions. One person we spoke with emphasized that while, yes, everyone wants efficiency, all that's being given is what he called chaos and confusion. For starters, there are major concerns that agencies may not be able to perform key duties with such large cuts to staffing, particularly among technical and scientific staff. Let's take the FDA as an example. That agency is losing 3,500 employees, or about 20% of its current staff. Experts fear these cuts will challenge the FDA's ability to continue to effectively regulate food and supplements. Meanwhile, an HHS fact sheet stated that the changes won't affect drug, device, or food reviewers or inspectors. But such downsizing may hinder its ability to regulate the new AI medical software and devices coming through. At best, this could mean the FDA will take a lot longer to issue approvals and authorizations. At worst, they may cut corners that lead to products going on the market that are a real safety risk for patients. Robert Califf, 2-time FDA commissioner, called this a huge mistake and was quite blunt in his assessment. He said that with most of the leaders that have deep understanding of product development and safety and the institutional knowledge, now that they're gone, the FDA as we know it is finished.
Talked about a lot of negative aspects of what's going on with HHS. I mean, is there anything positive that we know of that's coming out of the reorganization?
It's a good question. So the reorg aims to centralize human resources, information technology, procurement, external affairs, and policy across all of the HHS. The idea here is to reduce costs, streamline functions, and prioritize chronic illness. And one person we spoke with agreed with the importance of centralizing procurement, for instance, that it's been fundamentally broken across the government for a long time. This person also said that moving ASPR to the CDC is appropriate, given that both of these organizations have been responding to infectious disease outbreaks and other natural disasters in parallel. There was also praise for President Donald Trump's decision to tap Susan Monarez to lead the CDC, which one person called the silver lining of these changes, given her experience, which includes having served as deputy director of the Advanced Research Projects Agency for Health, all before becoming the acting CDC director when Trump took office. And to be clear, a lot of the experts that we interviewed said that changes to the HHS have long been needed, but the issue here was in how these changes were made. Given the extensive duties of the organization and the lack of detail provided in this plan, the worry is that reforms are not happening thoughtfully, that there is just not enough information, and information rooted in research on how these changes will play out. HHS Secretary Robert F. Kennedy Jr. has touted how reshaping HHS will reduce bureaucratic sprawl, and although most can agree that cutting down on waste and red tape should be a goal, the fear is we won't just see less bureaucracy, we'll also see less action.
What are some of the other changes that we can expect to see?
Sure. Frankly, more cuts. Federal research funding has taken a hit. For example, 29 NIH grants linked to COVID-19 research, many of them spanning broader pandemic preparedness, have been terminated. The concern here is that we'll now only be equipped to take a reactive approach when a disaster occurs or an infectious disease breaks out. And as for chronic disease, there are signs it might now fall under the new Administration for a Healthy America. AHA, as it's called, will fold together at least 5 different pre-existing groups focused on primary care, maternal and child health, mental health, environmental health, HIV/AIDS, and workforce all into one. Combining multiple agencies with such disparate needs could be a sign of scaling back on their missions. Overall, vital functions will simply need to be filled by other agencies, primarily due to cuts at the CDC. But it's unclear how that may play out. As for right now, no further cuts to HHS are planned, but the announcement did make it clear it will continue to be looking for further ways to streamline its operations. All right, that's a good segue into your recent reporting, Rita. Let's talk about your piece specifically on those CDC cuts. I know the experts you spoke with called them staggering and predicted they'll cost lives. Can you tell us more?
Sure, Kate. Yeah, this follows right into the story we were just talking about. I mean, the U.S. Centers for Disease Control and Prevention has been a global leader in public health for nearly 8 decades. But HHS abruptly fired 2,400 CDC employees on April 1st as part of the Department of Government Efficiency Workforce Optimization Initiative. And we know the Department of Government Efficiency is frequently referred to as DOGE. And according to the people I talked to, for my story, the reduction in force at CDC was far from optimal. For one, I was told managers didn't know who on their teams was going to be fired and were left to contact staffers one by one to check. And then another problem here, the reduction in force was so sudden that there was no time to plan continuity of operations. I mean, you can fire staffers, but you can't fire the lab they work for. And shutting down a laboratory involves a lot more than turning off the lights. I talked with a fired scientist who worked for the STD reference laboratory, which collaborated with regional and local laboratories to track the growing problem of drug-resistant gonorrhea and recommend appropriate treatments. Several thousand gonorrhea isolates are stored at the CDC's reference lab in Atlanta, and more arrived the day the staff was fired because they had no idea that the lab was going to be immediately shut down and that they were fired. But a few days after they were fired, the 38 STD reference laboratories' former employees received a plea sent to their personal email addresses. Could they come back to help shut down the lab? Now, not surprisingly, I'm told, few did. Not even the advisory committee of outside experts to the CDC director was in the loop about who was fired from the agency and why. The day after the layoffs, some advisory committee members sent a letter to HHS Secretary Robert F. Kennedy Jr. and Dr. Moneras, who, as we're recording the podcast, is still listed as acting CDC director, even though she is also President Trump's nominee to be permanent director. And a recent report came out and talked to some legal experts who said, you cannot be both. So it looks like there is no CDC director right now, acting or permanent, because she has not been confirmed. Now, the chair of the advisory committee to the CDC director, Dr. David Fleming, told me he was particularly concerned about substantial cuts in HIV prevention efforts, the firing of CDC staff members who investigated cancer clusters, and the wholesale elimination of the National Institute for Occupational Safety and Health, or NIOSH. Now, in their letter, the advisory committee members warned of, quote, an impending crisis precipitated by the indiscriminate elimination of vital CDC programs and termination of key CDC experts and leaders. Now, as of mid-April, neither Kennedy nor Moneras had responded to the letter. But in an opinion piece on April 10th in the New York Post, Kennedy wrote that HHS will announce details in June about how it's going to incorporate many offices that used to be at the CDC and other federal health agencies into the new AHA, or the Administration for a Healthy America. Meanwhile, he wrote, remaining staffers will be able to assume the responsibilities of their fired colleagues. And I just have to guess that a lot of those remaining staffers would disagree with that.
Yeah, and Rita, how are these CDC firings affecting state and local health departments? I love to hear what you covered about that.
Well, yeah, the state health departments and local health departments depend on the CDC for a lot of stuff, including funding. And I talked with Dr. Brooke Cunningham, who is the Minnesota State Health Commissioner. One reason I contacted her is her office had put out a press release about what they were having to do. I don't think a lot of health departments have done that, but the Minnesota Health Department was pretty outspoken about it. And two problems here. One, of course, is funding. I mean, they get, about a quarter of their funding has come from the CDC. And even their work plan for what they were going to do with this CDC money, it was approved about a year ago. The money has been rescinded. So like some of the things they plan to do with the money, like improve the heating and air conditioning systems in nursing homes to reduce the spread of respiratory infections. Another thing was they wanted to update their system for tracking immunizations. They had to drop that because they no longer have the money. They've had to lay off a bunch of employees because, again, their salaries were dependent on CDC funding. And then on top of all that, they work closely with people at the CDC. They depended on the CDC to alert them to, say, outbreaks in other parts of the country, like the measles outbreak in Texas. And now, Dr. Cunningham, the Minnesota Health Commissioner, said she has no idea if the people that they were, in regular communication with are even still at the CDC because there's been this blackout of communication. And I have to say, Minnesota is far from alone. I know I've read that, for example, like the Commonwealth of Virginia has had to lay off a bunch of people because of the rescinding of the promised CDC monies.
Any final thoughts on how all of this is going to shake out, Rita?
It's really hard to say because, like I said, there's been a communication blackout. No one knows who's still there. No one knows for sure what offices have been eliminated. And Secretary Kennedy is saying we're going to have to wait a couple of months to hear what the plan is for maybe incorporating some of what's been cut at the CDC into this new administration for healthy Americans. But we don't know, and I don't know what's going to happen until we, hear the details of HHS plans.
Well, I know you'll keep us updated, Rita. Thank you. If you'd like to learn more, we'll include links to the stories we discussed in the show description. In line with today's topics, earlier this month, Rita also reported on how dismantling diversity, equity, and inclusion efforts could make clinical trials less representative, and it's worth checking out. In recent weeks, we also reported on several groundbreaking studies. We covered how newly discovered genetic links to major depression and bipolar disorder might one day lead to new treatments. And we also dug into landmark work into visualizing LDL cholesterol structure and what those findings could mean for patients. We also covered research highlights from this year's American College of Cardiology's scientific sessions. And finally, our interview series on AI in clinical practice continues. You can listen to these episodes in this show's feed at JAMA Network's YouTube channel or at JAMA.com. Or better yet, follow the new JAMA Network podcast, JAMA Plus AI Conversations. That's it for this JAMA Medical News Summary. I'm Kate Schweitzer. Thanks again to Rita Rubin. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening and join us again next time.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.